Tom, Kalil, I was amazed when he got interested in what we were doing. He's a former head of OSTP under Obama, Office of Science and Technology, a policy, but actually was the quiet and humble originator behind the BRAIN initiative of the Obama White House. He put it all together, essentially, with help from a lot of other people, but he made all things kind of move behind the scenes. He now works with Eric Schmidt on a number of new innovative projects, and he's an expert's expert at what he's about to go through.
Thank you. Is everyone fired up and ready to go? All right. My primary background is in the area of science and technology policy. So I've had the opportunity to work for two presidents, President Clinton during those dark days of peace and prosperity, and President Obama. And I wanted to tell the story about how in April of 2013, President Obama announced the BRAIN initiative and said, as humans, we can identify galaxies light years away, we can study particles smaller than the atom, but we still haven't unlocked the mystery of the 3 pounds of matter that sits between our ears. And the story started when I got a phone call in late 2011 from Myung Chun, who is working for the Kavli Foundation. And she said, we just had this great workshop. Oh, Myung's there. She said, we had this workshop with people in the neurosciences and people in the physical sciences and engineering, and the neuroscientists were talking about how far they were from having a theory about how the brain encodes and processes information that is as elegant as the central dogma of molecular biology, the way that information flows from DNA to RNA to proteins. And when the physical scientists and engineers sort of said, why do you think that is? They said, well, we think we're limited by our tools. We can measure the activity of a small number of neurons with high levels of temporal and spatial resolution, or we can take a fuzzy picture of your entire brain, but we can't do things at the meso level. So, you know, this certainly cleared my bar for something that was worth President Obama getting behind. And then I started to interact with the experts in the government, people like Tom Insel and Story Landis and Jeff Ling, who is at DARPA, who's also here. And there was a lot of support within the research agencies, NIH, DARPA, the National Science Foundation, ultimately another agency called IARPA, and the president got behind it, and it now enjoys bipartisan support. Both Democrats and Republicans are for this, and NIH has actually gotten 10 years of support for this initiative, which is really unusual. So, you know, one of the things that I think is really useful is to occasionally step back and say, are there ideas that are bubbling up from the research community that we are underinvesting in relative to their importance? And in particular, are there structural reasons that we might be underinvesting, both from the public and private sectors? So I'm going to give a couple of examples of that, of cases where I think it's at least plausible that might be so, and then what are some different models for trying to address that? So, you know, the core premise that I want to argue today is that it would be useful as part of this initiative to have the following capacity. One is to identify these gaps and then figure out what should we, for some definition of we, do about it if we think this is something that is not just going to organically happen by itself. For those of you who are computer scientists, you probably know about this guy, Richard Hamming at Bell Labs. One of the things that he used to do that would really annoy his colleagues at Bell Labs is the first question he would ask them, his colleagues at the cafeteria, is, what do you think is the most important question in your field? And then they would answer that. And then he said, what are you working on? And a lot of times there was a gap between what they thought was the most important question and what they were working on. So he'd be like, why aren't you working on that? And so sometimes he would not get invited back to lunch. But I really think that this is an important question to ask the research community, because there may be some sort of dissonance or gap between what they in their bones believe is really important and what they're currently in a position to work on. So obviously in the United States, let me take a parochial US perspective. There's already a lot going on. NIH, which is the largest single funder of neuroscience in the world, is investing $8.1 billion in neuroscience across the different departments and agencies. We have the BRAIN initiative that enjoys support from not only NIH, but DARPA, NSF and IARPA. Growing support from philanthropy and private research institutes like the Allen Institute, the Kavli Foundation, HHMI, and the Simons Foundation. There are around 37,000 global members of the Society for Neuroscience. And if we're just looking at drugs, let alone medical devices, there are over 1,300 neurology drugs that are under development as of 2014. So clearly there's a lot going on. But I do think that there are areas where, again, I think it's plausible that we're underinvesting. So let me give you some examples of where those gaps might be from both the public and the private side. So, obviously, one area is focusing on human flourishing and resilience as opposed to reducing, disease and pathology. So this is an argument that in psychology, for example, the field of positive psychology has said, in addition to reducing suffering, we should also be thinking about, human flourishing. So I think that's one area where we may be underinvesting in on the public sector side. There's always a concern about whether we're adequately supporting high-risk, high-return research. So the gallows humor from the research community is that you have to have done the experiment before you write the grant. That is, you have to have enough preliminary results in hand before you can go forward. I think that peer review does a good job of, excluding clearly bad proposals, but it can also, particularly when only 10 to 15% of proposals are being funded, it could just take one person on the panel to say, well, I don't really see how how he or she is gonna do this for a proposal to get knocked out. So that's one area that is, I think, good to worry about. Research that is motivated by non-health goals. So given that NIH is the dominant funder of neuroscience in the public sector side, things that are related to education and training and neuromorphic computing are not goals for the NIH. The NIH does not have the mandate to say, what can we learn from how the brain encodes and processes information that could inspire the next generation of algorithms and computer architectures. Big science and industrial scale research. So there may be some problems that don't lend themselves to problems being solved by individual PIs or small teams. And that's why with things like the Allen Institute, you've seen some new approaches to funding neuroscience research. And then particularly in the physical sciences and engineering for the NIH component, this is another area that I think NIH struggles with. Phil Sharp, who's a Nobel laureate at MIT, has talked about the increased opportunities at the convergence of the life sciences, the physical sciences, engineering, math, and computer science. But a very small fraction of the NIH budget goes to support research that involves the physical sciences and engineering. Platform technologies, although this is clearly something that the BRAIN initiative is really helping on, but Ed Boyden and a number of his colleagues from MIT and Harvard have argued pretty persuasively that if you look at the impact of the platform technologies that we have invested in, things like next generation sequencing and PCR, these really have a profound impact on not only biomedical research, but research in lots of different areas. And again, this is probably an area that we're underinvesting in relative to its importance. And Ed and his colleagues have created a consortia that is aimed at identifying some of the most important platform technologies. So those are some examples where there's a structural or cultural or budget reason why the public sector may be underinvesting, but there's also reasons why venture may be underinvesting. And particularly at a time when venture investment is dominated by software, because a venture capitalist can look at that and say, well, this might be the next WhatsApp, so I might get these really large returns because software-based businesses can scale, they have low marginal cost, it doesn't take me a huge amount of investment to figure out whether the entrepreneur has product market fit. And then if we look at investments in other areas, they're a lot more capital intensive and they take a lot longer. So if you've got a Monday partners meeting of the venture capitalists, and someone has a great software idea and someone has a great idea for neurotechnology that may require a long period of investment and is more capital intensive and is riskier, that's not going to do as well. The other thing is, as Michael said, that the underlying business model may be really challenging for venture. So if a venture capitalist is looking for investments that are going to be 10x or 100x returns, that there are things that may be good for the world and may be financially sustainable, but that do not have the prospect of that 10x return that the venture capitalist is looking for. So one example is if you talk to VCs about prevention, they'll say, yeah, we generally don't invest in a prevention-oriented startup if the payback period is longer than 18 months. And that's because when they talk to the potential customers on the payer side, because of patient churn, they may not be willing to make that investment. So although the VC model is great at the commercialization and scale up of certain types of companies, it certainly does not solve every problem under the sun. Innovations that have high social returns and low private returns. So a good example of this is vaccines for diseases of the poor. So pharmaceutical companies do not work on these types of problems because poor people have no money. So economists have had to come up with some really clever hacks for solving these types of problems. And one is a purchase order for a product that doesn't exist yet. So as a result of this work, 5 countries in the Gates Foundation went to GSK and Pfizer and said, if you develop a vaccine for this disease, then we will commit to purchase it for $7 a dose. And that motivated GSK and Pfizer to develop a vaccine that will save the lives of 7 million poor kids over the next 20 years. Tools is another area. So, obviously there have been some exceptions, important exceptions like Illumina, but the conventional wisdom in the VC community is that the majority of the value associated with tool development is captured downstream and not by the investors in tools. So I'm sure you can think of many others, but these are a couple of examples of where both the public and private sector, there is some sort of structural reason why they underinvest. So what are some models for addressing these gaps? So one is that we now have the phenomena of the empowered billionaire. And so there are a couple of interesting things that are going on. One is that they are increasingly, as opposed to just solely creating a traditional foundation, they are using an LLC structure that gives them the ability to engage in philanthropy, impact investing, an area where Steve Case and his wife Jean have been real leaders. Market rate investing, advocacy, and coalition building. And so the combination of using all those tools as opposed to just one of them is very powerful. And then in the neurotechnology space, we see high net worth individuals supporting startups like Neuralink and Kernel, not necessarily because they think that's the most profitable thing to do, but because they think it's important for humanity. Reid Hoffman, who will be speaking later and is one of the organizers, has said, with great power comes great responsibility. So it's really interesting to see high net worth individuals stepping up and making some of these important investments. You're also seeing the creation of intermediaries for impact investments. So the types of opportunities that Michael talked about that might generate a financial return, but not the 10x return that VCs are looking for. Organizations like Prime are trying to solve this problem in the area of clean energy. There are numerous mechanisms that are beginning to emerge to bridge the valley of death. A graduate student or a postdoc or a faculty member has this tremendous idea, but there's still too much technical risk for the venture capitalist to invest in. Cornell Tech has a startup postdoc model. Cyclotron Road, which is at Lawrence Berkeley National Lab, does a call for entrepreneurs and allows entrepreneurs to use Lawrence Berkeley, all of the facilities associated. MIT has the engine. Peter Thiel's foundation does grants to startups that turn into equity if there's an A round, but it remains a grant if it doesn't. So people are experimenting with different models for addressing the valley of death issue. And then obviously one can also imagine designing and launching and building the case for additional national research initiatives that might build on the BRAIN initiative or might go in other directions as well that are designed to address specific gaps. So, in interacting with a lot of researchers, one of the things I try to do is to work with them to say, what's the best way to communicate this idea to a broad audience, not just your peers. And so these are some of the things that I think are attributes of a compelling idea. One is that there is an ambitious and clearly important goal. So I shouldn't need to explain to you why, for half an hour, why it would be good to achieve the goal. So people would understand that. There's a Goldilocks level of specificity. So it's not so broad that it's boiling the ocean, or it's not so narrow that it's the equivalent of fund my lab, but it's sort of this mid-level of specificity. There may be a compelling why now story. So is this something that would have been impossible 5 to 10 years ago, but now is possible, and why is that? So is there improved fundamental understanding or technological advances that put that goal within reach, or is there increased urgency associated with solving that problem? Can you imagine building a coalition of the willing and able to support this idea? And what's its potential to inspire and engage the broader public? So obviously an idea doesn't have to have all those attributes, but I think those are things that, at least over the course of my career, that have observed that can really get traction. For those of you who are familiar with DARPA, this is a really valuable set of questions that all DARPA program managers have to answer. That comes from George Heilmeyer, who is a former DARPA director. And these are deceptively simple, but if you can answer these questions, it's likely that you have a really good idea. So it's asking some of the same questions. What are you trying to do? Articulate your objectives using no jargon. How is it done today? What are the limits of current practice? What's new in your approach? Why do you think you're going to be successful? Who cares if you're successful? What difference will it make? Et cetera, et cetera. So these are a really good set of questions for helping to design ambitious research initiatives. So I think there's this community has a real opportunity to do what President Kennedy advised us to do, which is he said, by defining our goals more clearly, by making it seem more manageable and less remote. We help all people to see it, to draw hope from it, and to move irresistibly towards it. So no pressure, but that's what the charge for the rest of the 2 days is. And I look forward to working with everyone to make this effort a success. Thank you.